So thyroid cancer is a relatively rare condition, although its incidence is increasing for a variety of reasons. Many patients do have very good prognosis disease, and many patients are cured with a combination of surgery and in some cases radioactive iodine treatment. But there really have been quite a lot of unanswered questions, and particularly because patients do generally have a good prognosis. It's been uncertain the degree of treatment, and particularly whether or not they need radioiodine treatment or how much treatment they need, and that's really one of the questions that's been addressed by the HiLo trial. So the HiLo trial really looked at two main issues in the treatment of this group of patients. So first of all, the activity or the amount of radioactive iodine that we need to give to these patients. And what the trial found from that point of view was that actually we can get away with giving a lower activity, a lower amount of the radioactive iodine, while still effectively treating the patients and them having as good an outcome. And that's very advantageous because if we give a lower amount of the radioiodine, we're likely to cause fewer side effects. And one of the particular concerns with getting a radioactive treatment is the risk of causing further cancers with the treatment. And if we give a lower dose, the risk of that is lower. The second issue that the trial addressed was how we prepare patients best for the treatment. So historically, we had to ask patients to stop their thyroid hormone replacement therapy prior to the iodine treatment for the treatment to work as well as possible. And that was to allow the levels of a hormone called thyroid stimulating hormone to rise. Whilst that was very effective at making the treatment work, it made patients feel terrible. They were effectively hypothyroid, so they felt very tired and often quite depressed. And what's become available more recently is a recombinant preparation of thyroid stimulating hormone known as Thyrogen. And what the trial was testing whether using this recombinant TSH was as good as thyroid hormone replacement therapy. And again, the trial did show non-inferiority for that treatment, showing that use of Thyrogen was as good in terms of treatment efficacy, but much better from the point of view of patients' quality of life. Both of the changes that have been facilitated by the findings of the trial do certainly have the capacity to improve quality of life for patients. So first of all, if we use a lower amount of radioiodine, the side effects are fewer. So one of the particular problems patients can experience after radioiodine treatment is damage to the salivary glands that can leave them with a permanently dry mouth. And we know that using a lower amount of radioiodine reduces the risk of that happening. There are also implications for how the treatment's given. So with the previous higher dose, patients generally had to be admitted into hospital for a couple of nights because of the radiation protection issues around the treatment. But now with the lower dose, we can give this treatment on a day case basis, so patients don't have to spend time in hospital in isolation, which was really quite hard for them. And then finally, with the use of Thyrogen, the study showed significantly improved quality of life, and patients could get back to their daily activities, work and caring responsibilities much faster if they'd had Thyrogen than if they'd had thyroid hormone withdrawal and then had to recover from that before they could get back to normal.